the multi-state National Health Service Corps recruitment retention program has been something that's been, very worthwhile. We had a lot of states from across the country, from Delaware to Alaska, working with us. And in our state, we have about 100 obligated health care providers at any point in time. And I know other states that we worked with, like California, for instance, they may be 10 times the size of us. So I think the larger your state is, chances are the more information you're going to be able to garner and use out of this in a much easier fashion. The multi-state retention collaborative that we had was something that I had worked with Dr. Don Pathman down at the Sheps Center and the folks at the North Carolina Foundation for Advanced Health Programs. Has been very supportive and responsive to us being able to get this system set up and continually used. One of the things that we've done now is to make it a web-based software program, and it makes it much easier to go ahead and implement. There really isn't any software to own on your computer other than having an internet service provider there. And the storage of the data and information is all done in North Carolina, but can be easily viewed from your own state's situation. This is more of a longitudinal type of software program, and it should just continue to build. This can be easily expanded across the country to as many states that want to go ahead and use this. What we're trying to find out really is something more about, what are the indicators behind retention? What causes someone to basically want to leave a location? What is the reason that they don't fit with the practice that they've gone to? I think some of the basic things that we've seen and found, of course, is almost like any job. Does the personality match, or is their training good fit for them? And do they fit well with the other providers in the healthcare practice? That information goes down to the Sheps Center, and it's compiled there. But as a state, you are able to go ahead and look at individual reports. And when you find that there's an indication that somebody's having some difficulties or issues at site, so you can then go out and address that with the individual as well as the site. But always trying to maintain, or I should say, always maintaining the confidentiality of the information gathered with that. So this retention management system allows you to go ahead and intervene early on in the process when you have potential problems and issues arising. Some of the things that are really nice about it is you can actually go ahead and use this for a variety of both your federal and state programs, incentive programs that you have within your state. If you have healthcare professionals in one program but not another program, any of them can be included, and you can do comparisons across the various programs. One of the things that we're really hoping for here is to not only go ahead and be able to share this or compare programs within your own state, but then amongst states as well. And with our multi-state program, we did some of that with about a dozen states across the country, and it was quite interesting to go ahead and find out which states may have had a higher retention rate, why they had a higher retention rate. You can go ahead and share this as grouped information, so you're not having to deal with the confidentiality of the individuals out there, but again can give a lot of good guidance for each of their programs, how to make them being improved. So I think that's been one of the, again, wonderful pieces with this program, and we're able to then share that information back, for instance, with the National Health Service Corps or our own state loan repayment individuals, and say, yes, it truly is going ahead and addressing the needs of the patient population that you want to see served out there. The key on this is really that the fact that it's web-based, it's been well-documented, well-tested process out there for going ahead and determining somebody's likelihood of staying at locations or moving. But all of us have the same goal as sharing this information, is just to enhance our retention rates. We all know that we can make improvements and have improvements with that.